Welcome back to The Fight. I'm Tricia Sloma. Now with us live, all the way from Dublin, Ireland, is Dr. Sam Gray, a Naughton Fellow in the ESTEEM program at Notre Dame. Sam, welcome to The Fight.
Hi, Tricia. Thanks very much for having me.
Okay, what time is it there?
At the moment here, it is 8:10.
Okay. All right.
Yeah.
Well, hey, I understand you changed your post-graduation plans to go home to Ireland and volunteer in the local hospitals there. Talk about a sacrifice. Can you share a little bit more about your plans and why you decided to change them?
Yeah, well, I returned home to my former employees at University Hospital Limerick and joined the intensive care team as part of the Department of Anaesthesia and Critical Care. So I'm a senior house officer. It basically means like a junior resident. And I had previously practiced in the hospital, so it was an easy enough environment to come back to, and it was familiar. When the crisis started to hit Italy, I think I was in California with my peers on the ESTEEM program of Notre Dame, and then I suppose it became kind of profoundly clear to me that I wanted to return and to help out in any way that I could on the ground. I think like Ireland before the crisis had one of the lowest ICU beds per population in Western Europe. And so they've incredibly expanded capacity since this began, but it really seemed like something important to me to do. So.
Oh, I bet. Well, what has the environment been like serving on the front lines there in Ireland?
Yeah, look, I've been very lucky, and I think a lot of my colleagues would feel the same way. We've got a huge amount to thank the Irish public for, to be honest. Like the government acted fast, and the Irish public really embraced the lockdown measures and the social distancing measures, and endeavoured to flatten the curve wherever possible, which allowed us to I suppose to keep things at a just about manageable level. And I've been very lucky personally as well, because as I said, I came back to this team of really, really passionate and dedicated anaesthetists who made my learning curve, which genuinely now my learning curve was very steep because I am very junior in the hospital. So it really made it that bit less steep. And as a result, it's been challenging, and the system is stretched, of course it is, but we've been lucky because the whole Irish community has banded in. It's not just, hospitals, it's the public as well. And everybody from keeping supply chains open to groceries, rock stars and the public have all been banding together to help the effort. So it's really been quite something to see.
Well, Dr. Gray, can we get personal now? How has this impacted you? Is there a most memorable moment so far?
Yeah. Look, I've had good days and I've had bad days, and I've had to learn a lot in a really small period of time, and that learning curve has been steep. But I suppose as to how it's impacted me, like jeepers, like I've looked around and I see peers here in Ireland who are collaborating with senior clinician leaders in London, in New York, in Rome on a nightly basis. Like some of the leaders in my hospital are working 24/7 and with no real thought for time or burnout or overcommitment. And I know that the situation is absolutely the same across the world. So in terms of a personal impact, I suppose it's quite profound seeing communities banding together, not just in the hospital, but across the country and indeed across the world. Like my peers in the ESTEEM program have now gone home to their respective homes across the US and across the world indeed. And since I've left and since they've left, they've set up initiatives to raise money. They've set up initiatives to have young and less vulnerable members of the community support elderly, more vulnerable members. So there's been an absolute extraordinary effort across the board for people to really just chip in as part of a big community. No more than this initiative. I must say it's a pleasure to be on, and the significance of this cause is just something that strikes me as really profound and really important. A number of my peers have experienced increased financial aid needs as a result of this, and of course I think we should all spare a massive thought for the increased mental health needs that are arising over the course of this crisis and the lockdown. And so I would absolutely urge anybody listening who's in a position to help out with this cause to do so. I certainly will be counting it a privilege to do so.
Oh, absolutely. Dr. Gray, thank you so much for joining us today. You have our prayers as well. And thank you for all that you're doing to serve your community over there in Ireland. We appreciate you.
Not at
And
all. Thank you very much for having me. Take care,
thank
Trisha.
you.